Unmute yourself, Kalyan.
Yes, indeed. Thank you. It's my mistake. Good evening, all Southerners, and a happy Ugadi and happy Tamil New Year to everyone. I had the pleasure introducing Professor Dr. P.B. Sivaraman, our speaker of this evening. He is one of the most distinguished and well-known urologists. He is the chairman of CuriHospital, Chennai. He was the professor and head of the Department of Urology at Madras Medical College. Dr. P.B. Sivaraman is one of the most experienced and respected senior urologists in the country. He pioneered kidney transplants in India and has been honored with a Doctor of Science by MGR Medical University. Trained in UK, Poland, and Japan as well. He has performed nearly 2,000 successful kidney transplants. He has worked for 5 years in higher training at various urology department centers in the UK. He was also the consultant urologist at King Khalid Hospital, Saudi Arabia. Coming to his education, he is an MBBS from the prestigious Madras Medical College and passed out in the year 1969. MS from the same institute in the year 1974 in general surgery, and MCH in genitourinary surgery in the year 1978, and an FRCS in the year 1983 from Edinburgh. One of the first surgeons to perform cadaver kidney transplantation in a government institution in India. In appreciation of his human service to poor patients, he has been awarded the Lifetime Achievement Award from the Rotary. Recognizing his contribution as a urology teacher, both his students as well as the professor community have instituted an endowment oration in his honor in the Urological Society of India in the South Zone. Very happy to have you, sir. Today, he will talk to us about common urological problems, some of which people are embarrassed to talk about. These include urinary incontinence, stress incontinence, overactive bladder, urinary tract infections and kidney stones, and other urological crises. Over to Professor Dr. P.B. Sivaraman. Thank you.
Good evening, everybody. I say thanks to the entire Rotary Club for giving me this opportunity, and Happy New Year to you all today and tomorrow. Today, as he explained, I am going to talk about the common problems in urology, but unfortunately the common problems are heavy numbers. So we can only touch upon about 3 or 4 topics. So I have selected few topics. They are so it is enlargement of prostate, which is very common in men only, especially elderly men. And then benign enlargement and cancer of the prostate. Next is stones in the urinary tract, kidney, ureter, and bladder, and hematuria, blood in the urine. If time permits, I'll talk about urinary tract infections also. First, we will start about prostate gland. Prostate gland is only available in men. And this is the photograph of the prostate gland. It is below the bladder, and it is a male sex gland, pear-shaped, about 7 to 16 grams, size of a walnut, contributes nourishment to semen, produces prostatic specific antigen. That is the purpose of this gland. But once the purpose of getting children, everything is over, this becomes a gland which is not very useful, but except giving a lot of trouble like benign hypertrophy and cancer prostate. Okay. The common symptoms of prostate gland, which is just below the bladder, is weak urine stream, frequent urination, dribbling after urination, urge to urinate, and leakage of urine when there is overflow, and frequency in the night. So what causes these symptoms? Prostate grows with age. Actually, it is not a disease. It is growth with age, like gray hair or having glasses, like that. Over the period of time, everybody prostate will enlarge. Only the various sizes, various dimensions. They grow with the age. And when it grows bigger, you can see the normal bladder is on the left side. See the bladder and then the prostate, the urethra is not compressed. Whereas in the right side, the prostate enlarges and compresses the urethra so that all your symptoms come. When should the benign prostatic hypertrophy be treated? BPF symptoms are no fun. See, frequency, urgency, and nocturia are not fun. BPH needs to be treated only if the symptoms are severe enough to bother patients and affect the quality of life, or it produces renal failure, or the frequency of urinary tract infection, or it produces blood. All these things should be there. Unless these symptoms are there, you don't need to treat the BPH. So what are all the treatment options in prostatic hypertrophy? One is watchful waiting. Suppose mere presence of hypertrophy or hyperplasia, enlargement of the prostate gland, does not mean that you should start treating it. We can wait and watch whether it is impacting on his quality of life. Next treatment is medications. First, you don't go for any operations. We only do medications. Then in office therapy, there are some heat therapies and all, it can be done in the office. It is not very common. And third is a surgery. So last resort is a surgery. So watchful waiting, we just tell the patients to eat less, drinking water after 9 o'clock, avoid tea, aerated drinks like that, so that you can avoid getting problem to the quality of life. Now, this is a small video which shows the bladder and also the urethra surrounding by the prostate. So this is the prostate. When you give medicines, alpha blockers, they enlarge the bladder neck. You understand? Then the patient can pass urine better. When we give 5-alpha reductase, another type of medicine, it reduces the prostate. So when we combine both, its size is reduced as well as the urinary passage is enlarged. So the patient starts passing urine normally. So we can totally avoid an operation if we give medical treatment itself. So what are all the surgical procedures? Prostate, as I told you, is a gland underneath the bladder neck and it prevents the urine from passing very clearly. So there are few methods. Transurethral resection of prostate. That is, transurethral means we pass a scope through the urethra and then resect the prostatic tissue which is obstructing the urinary passage. It can be done by laser technique or incision. So I'll just show you the instruments used for that. This is the cystoscopy where we pass a scopy into the urethra, male urinary passage. This is the prostate. If you go into the bladder, then we reach the bladder. So just below the bladder, this is the prostate gland, which completely obstructs the urinary passage. If it obstructs the urinary passage, by medicine, it is not going to be all right. In spite of treating with medicine, the patient is not better symptomatically. We do the TURP. This is called transurethral resection of prostate gland. Electrocautery we use and then resect the prostate gland and also coagulate all the bleeding points. See, you can see this is the right lobe being taken. So if we put after the resection, we put a catheter for 3 to 4 days so that all resected areas will heal. Then we remove the catheter. Then the patient will pass urine far better than what you were doing before the operation. So all these bits will be evacuated by a small helix evacuator so that the bladder will be clear of all the bits. So this is called transurethral resection of prostate, which is the commonest operation performed for prostate when it is benign prostatic hypertrophy. So once you see this is the prostate, which is completely obstructing. Now after the resection, the hole will be like this. So the patient will pass urine better. So the same thing can be done by laser also. Laser also you can use and then excise one lobe and the another lobe and remove it. The other surgical procedures are if the prostate is very big, cannot be removed transurethral, then you can use suprapubic or retropubic prostatectomy. That is an open operation. Another is laparoscopic surgery. The last is robotic surgery. All three things can be done according to the availability and the expertise to remove the weak prostate glands. Other methods will be there, which is not very commonly used: microwave therapy, needle ablation, laser coagulation, and thermotherapy. These are not very popular. So next I'll talk about cancer of the prostate. The same benign prostate hypertrophy, some people will have. Some people will develop cancer in the prostate. This is the area I'm just showing. This is the cancer. So there is T1, T2, T3, T4. The first T1 and T2 are within the prostate gland itself. And 3 and 4 are advanced prostate gland, prostate cancer. So the treatment options for prostate cancer are active surveillance. That is, if you diagnose a prostate cancer, you can actively have a monitor that person with the frequent PSAs and biopsies to see whether they are developing into a serious matter or not. Then when it goes into serious matter, we can do the treatment. That is active surveillance. Next is surgery. Surgery is radical prostatectomy. That is done usually by open surgery before and laparoscopy later. Now the robotic surgery has come into place. Nobody is doing radical prostatectomy by any other method except robotic surgery because it is totally bloodless and very clean and completely successful. And the patient can walk on the first or second day itself after the operation, which was not possible before when we are doing open surgery, in which they have to lie down for 1 week to 10 days. Now, the other possibilities is, suppose locally advanced, you have to do radiotherapy, and if it is still advanced, you have to give hormone therapy. And metastatic prostate cancer, suppose it goes to other places in the bone, in the other place, in the lymph nodes, then you have to give chemotherapy, and then lastly, targeted therapy. So this is a robotic surgery for prostate cancer. This is a machine. The person sits outside the near the console, away from the patient, and then he removes the prostate with this instrument. The biggest advantage is very little blood loss and perfect anatomy is seen there. So the resection margins usually be completely negative and complete removal is possible. Prostate cancer screening. So what do you do? Suppose a person is above 45 or 50. The screening test like prostate specific antigen screening test is there. That antigen is produced in the prostatic gland only, and it is if there is a cancer or some infection or some injury, the prostate specific antigen, which is supposed to be inside the prostatic gland itself, escapes into the general circulation and the PSA rises in the blood. So if the PSA is raised, then you have to suspect cancer prostate or infection, which can be diagnosed by digital examination. You put a finger in your back passage and palpate the prostate to find out whether there is any pain, tenderness, or nodules or hard prostate. Then it will reasonably conclude, and we have to do the other test to confirm the prostatic cancer. Recent research has shown that deaths from prostate cancer has decreased by 30% since the PSA became available. So above 45 to 50 years, everybody who goes for master health checkup has to have PSA as one of the criteria in the checkup, as well as if it is very high or higher than normal, they have to get a urological consultation. The urologist will do a rectal examination and confirm and do it biopsy to reconfirm the cancer. Early diagnosis can help catch the cancer before it becomes life-threatening or causes serious symptoms. So, 55 years old to 69-year-old people should always make individual decision about being screened for prostatic cancer with PSA. See, nowadays the slogan is never be afraid of cancer, but be afraid of not detecting it early. So prostate cancer is a classical example where if you detect early, the cure is nearly 90%. Right. Next, I'll just talk about few words about the urinary stones. You are very aware that urinary stones are so common and it has got no age limit. It can come from 10 years to 90 years. So the stones usually are in the picture in the left side, you can see the stone can be in the pelvis or inside the calyx. There is one calyx inside, that is a stone. And another stone is in the ureter. There is a kidney, ureter, and bladder. So anywhere it can be there. And then because of the stone, there will be some block to the ureteric flow of urine. See, we can see the dilatation of the kidney. So the stone has obstructed the urinary passage and the kidney has bloated up. If you allow it to go like this, the kidney will get spoiled over a period of time. So stone disease, there is a limit for expecting it to come by itself and then doing the surgery or endoscopic removal. 2 out of every 1,000 men can get stones, but 3 times more than women. So the women are less prone to get renal stones. Types of stones, usually 80% are calcium stones, oxalate stones is second most. Struvite can be due to bacterial infection. And the uric acid stones, which hyperuricemia is a medical condition in which the uric acid is secreted in high quantity, they also form the stones. The factors that affect normal balance of urine, decreased fluid intake, suppose the person is dehydrated, and if there is a urinary stasis due to obstruction, as I told you, the prostate will cause obstruction, then there will be stasis of urine. In that cases, even stone can form in the bladder due to prostate. The crystals precipitate more readily, and then if the patient is immobilized, then also there is a chance of forming stones. Many times the people who have spine fractures, previously tuberculosis, they used to lie down for 3 to 4 months. Those patients are more prone for getting renal stones. So how the symptoms come? Renal stones start from the kidney usually, then come through the ureter, and then there are usually very rough edges are there. It is not very smooth stones. These rough edges will injure the urinary passage. See, you can see from the video, the stone is coming slowly from that. It can get obstructed in 2 places. One is when it crosses the blood vessel, another is when it comes into the bladder. These are the common places where the obstruction comes. Why there is pain? Because the ureter is a very soft mucosa. The rough edge of the stone injures and produces blood as well as pain. This is how urinary colic is supposed to be very painful. So preventable risk factors. How to prevent stones from occurring? One is preventing dehydration. Another is water, plenty of water. And then dietary factors like low sodium, never take excess salt, normal calcium, and low animal protein. Animal proteins, high amount of intake, they are very prone for stones. Or excessive vitamin C or vitamin D. And then activity level. Sedentary people get more stones. And certain medications increase the stone formation. So I have given some example of diets. Low fat yogurt, papaya, bananas, watermelon, they are all good for not forming stones. Avoiding is high oxalate foods like chocolates, uh, Swiss chard, rhubarb, potatoes, beetroot, like that. Next, how to find out when there is a person with stone disease. First, urine analysis and urine culture to find out any infection along with this. Then ultrasound scan or X-ray, KUV and CT scan. These investigations will pinpoint where the stone is. How to remove the stones. Extracorporeal shockwave lithotripsy. ESWL is there. The litho means stone. Tripsy means therefore crushing. So what we do is, in small stones, we have this machine which will break the stone from outside, without injuring the in-between tissues like skin, muscles, bones, directly goes to the kidney and only crushes the stones. This is called extracorporeal shock wave lithotripsy. You can see the ultrasound shock wave coming here, and the stone is being broken into pieces. The small stones will be passed through the ureter. So next is ureteroscopy. Ureteral stent may be placed and then lithotripsy will be done. This is the example how a ureteroscopy is being done. We pass a small tube with the basket into the ureter through the endoscopy. This is the stone. We bypass the stone, open the basket so that it will not go into the kidney. Then we crush the stone with laser. See, this is a laser fiber through which the stones are crushed. The entire stone will be removed completely. So, this is how ureteroscopy is done. And the rest of the stone will be removed. Next is percutaneous nephrolithotomy. That is, through the skin, we put a small hole like a pen size and then go into the kidney. We break the stone and completely remove the stone through the small hole itself. Previously, these big stones used to be taken by major operations. Now, it is not done like that. Only a small pin hole and then you can remove the stone completely. So this much about stones. Sorry, I'm just rushing through because I was told that I can only have half an hour. So hematuria, another common problem. Because when there is blood in the urine, you should always be very careful. Any disease, all the organs, suppose if you have tears, it should be tears. Nose means only phlegm, and also in the mouth only saliva should come. Motion only motion particles, urine only urine. No blood at all should never come. So blood in the urine is always a serious matter. Whether it is not serious or serious, we have to investigate and find out. So what are the causes of classification? This is microscopic, means RBCs will be seen in the microscope, but the patient will not be able to see the color. Okay? It can be from the kidney, ureter, bladder, or urethra. Urethral bleeding is not called hematuria, but urethra bleeding also can see red urine. And also medical renal disease. Nephrology causes are also there to have blood in the urine, like glomerulonephritis, drug-induced, subacute bacterial enterocolitis. All these things can cause. So we will come for urological causes. Urinary tract infection by itself, cystitis, urethritis, and pyelonephritis can cause blood in the urine. And stone disease can cause, as I told you in the previous, showed you in the previous picture, the stone when it comes into the urethra and the ureter, it will injure the mucosa and produce bleeding. BPH, benign hypertrophy of prostate, can also cause bleeding. Apart from this, trauma, any injuries, road traffic accident injuring the kidney and the bladder, they can cause also the bleeding. Last but not least is the tumors. Any kidney tumor, cancer in the ureter, kidney, bladder, or prostate can produce blood in the urine. And sometimes diet, beetroot or blackberries and hemoglobinuria, they can be without any blood, only red color urine can come. So urine test has to be done, imaging, ultrasound and CT scan, and endoscopy. All these things you will find out. See, this is a cystoscopy where the bladder has got a stone, which stone will produce bleeding. So by endoscopy, we can remove the stones and find out why the bleeding was there. So kidney tumor, can you see the green color is the kidney tumor. This X-ray also, CT also. Kidney tumor can cause the bleeding. And bladder tumor. See, this is the bladder. Can you see on the left side? This is the bladder. This is the right side is the bladder. Actually, when you see by cystoscopy, it will be like this. We will see this, and then we can excise it with the electrocautery completely. See, it has been removed completely. Once if you remove, we have to follow it up every 6 months or 1 year to see whether it is coming back or not. And there are medicines to prevent it from coming back. So, hematuria is a serious problem. Never ignore it. Saying, and it's sued, all those things is commonly said. You should not do that. Okay? So, trauma. Last but not least is the trauma. Whenever there is an accident, you can see the kidney, major injuries, minor injuries are there. It will also start bleeding. So, hematuria, that is the cause. So, management. Treat urinary infection if it is there. Removal of stone if it is there. Removal and resection of tumor if the cancer is there. That is the treatment. Trauma means you can do conservative treatment. Sometimes you can embolize by doing an arteriography and repair of laceration by open, and also partial or total nephrectomy if it is completely injured. These are all the things which how you manage the hematuria and due to the trauma. Urinary tract infection is the last. If I have time, I will tell.
Yeah, please go ahead, doctor. Please go ahead.
Sorry. So what are all the risk factors? See, women have more chance of urinary tract infection because, as you see in the picture, the urinary passage is very close to the rectum and the vagina. This area is totally covered by bacteria from the rectum. So whenever there is a small chance, the bacteria will enter the bladder because the urethra is very small, 3 centimeters only, whereas male urethra is 4 times more than that. So diabetes is one of the comorbid conditions which can produce infection. Obstruction to the urinary passage, I told you, due to stone or due to prostate. And stones in the bladder can produce urinary tract infection. Female anatomy is more prone for urinary tract infection. Foreign bodies like catheters, stents can also produce urinary tract infection. Common symptoms are burning or painful urination, frequent urination, and lower abdominal pain, and strong urge to pass urine, and cloudy or blood-tinged urine, fever with chills, nausea, vomiting. All these things are the symptoms of this. So you must do urine routine test and culture, ultrasound CT to find out the cause, whether it is primary urinary tract infection or secondary to some other problem, and the blood glucose level, HbA1c, to see whether the diabetes is also contributing to the urinary tract infection. So the best method is to prevention. Take plenty of water, make the local hygiene, timed voiding, and antibiotics whenever it is necessary, and treat the cause of the urinary infection like stone, diabetes, or prostate. Thank you. If you have any doubts or questions, I am here to answer. Thank you very much for the patient hearing.
This prostate enlargement and prostate cancer, are Indians more vulnerable to it than people from any other country or other countries?
No, not that Indians are. Actually, Black Americans are supposed to be more prone for this. India the number of prostate cancer is very high because the population is very high, not because that it is more prone for us. And another thing is the early diagnosis is not there in India. In some of the rural areas, PSA is not being done very routinely. So we miss the prostate. Once it becomes advanced, it is very difficult to treat. As I told you, do not be afraid of cancer, only be afraid of not detecting it early.
Doctor, does the type of underwear that one wears influence any of these?
Nothing. Totally not. Nothing to do with urinary tract infection. No.
Doctor, there is, normally we are asked a question whether we are able to hold the urine passing, or is it that the urge is there very often? There is always a question from the doctor whether we are able to withstand and hold the urine passing for some time, or is it in a hurried manner? Are we able to, or we are forced to pass urine? So is this an indication of anything wrong?
Yeah, urgency is an indication that there is some infection in the bladder or the prostate is enlarged. Urgency. That means before you go to the toilet, few drops try to come out, but you are holding it back. Right? It is an indication.
So long somebody is able to hold it for quite considerable time, then there is no problem for the same person.
The way we diagnose prostate. This is only one symptom. Yeah. You may not have any symptom, prostate may be very enlarged and finally spoil the kidney. So what you should do is, whether you're holding it for a long time or urgency is coming, doesn't matter at all. We have to check above 45 years, ultrasound, PSA.
Okay. Right. Thank you, doctor.
Dr. Kalyan here. How many liters of water should we drink every day and at what frequency?
So the frequency, see, totally we advise them to 3.5 to 4 liters, especially in a tropical country like ours. We have to pass at least 2 liters of urine so that everything is flushed off, all their urinary dirty products like urea, everything will be done so that all the products will be washed off. But if you take less water, if you have less urine, then it becomes concentrated. There is a chance that stones may form.
Can you mention the PSA test? How long does it take? And the PSA test?
It's about 6 hours, 8 hours. If you give today, tomorrow it will. Like any other blood test. You do it along with other blood. If there is no.
Any more questions? Any more clarifications?
My lecture is not so good. That's why questions are not coming up.
I now request Rotarian Sarvesham to propose a vote of thanks. Sarvesh?
I'd like to wish all our dear Rotarians and guests a very happy Ugadi and Ramadan Kareem to all celebrating. On behalf of the Rotary Club of Madras South, I'd like to express our heartfelt gratitude to Dr. and Professor P.B. Sivaraman for taking the time out of your busy schedule to enlighten us today. Sir, it truly has been an honor. This session has a special significance for me personally, as I lost my father to prostate cancer a few years ago, a loss which I'm still fighting to come to terms with. It is therefore so important for people of all ages to be aware of their health and to take it seriously. The great psychologist Carl Jung famously said, "Medicines cure diseases, but only doctors can cure patients." In the light of these strange and challenging times that we live in, the vital and priceless role that doctors play in our society has been acknowledged all over the world. As the ancient Sanskrit adage goes, Mata, Pita, Guru, Devam, I would like to propose to tweak this in your honor, sir, as Mata, Pita, Vaidya, Guru, and Devam. As a doctor and a teacher, it is only fitting that we honor you twice. Thank you, sir, for your service, your knowledge, and your valuable time. Thank you so much. Over to our president for the closing remarks.
And I
Thank
may
you, Sarvesh. That was very lovely. And our prayers with your father.
Thank you.
And
Thank
you
you
need
so
to
much.
get over it.
And I must compliment you on the PowerPoint presentation. Beautiful. All the visuals were excellent and very clear, very lucid. It's a wonderful medical presentation.
Thank you. Thank you.
Thank you. So this meeting of the Rotary Club of Madras South is adjourned.